Hello, everybody. We're back to part 2 of this series on heavy periods and heavy bleeding with Lara Briden. In this one, we're going to cover medical treatments for heavy bleeding, but we're also going to look at ways of diagnosing why you may be having heavy periods. So, Lara, if you want to jump in there, and we'll start.
Yeah, we'll just start with that. It's quick, actually. It's just usually if you go to your doctor, the first thing is to try to explain to the doctor how much, in numbers, how much your menstrual fluid you're losing, because the doctor does need that information. Like we talked about in episode 1, the normal is anywhere up to 80. So if you say to your doctor, look, I've estimated, I think I'm losing like 200 milliliters of menstrual fluid in a cycle, and I understand the normal is 80, so I really think something's going on, then the doctor will to achieve to be able to rule out or diagnose some of the conditions we talked about in the first session. Likely is going to require a blood test to rule out thyroid. For example, the doctor may want to screen for coagulation disorders, like we talked about, depending on your clinical history. And then there may or may not be some hormonal testing. It just worth saying, like the high estrogen, low progesterone of perimenopause is not easily picked up by a standard blood test, but definitely blood test for thyroid. I might have said that already, but thyroid, undirected thyroid is important possible cause that needs to be looked at, including testing for the extra test for thyroid antibodies or TPO antibodies, which I might encourage you, especially if you're working with a naturopath or a more integrative clinician, to actually go ahead and get that extra test, even if you have to pay for it yourself. I know my Sydney patients used to just pay for that test because it was often not a bulk billed test, and it was like $40. So it's not an expensive test, and it's good information about what's happening. And then the other part of the assessment is usually pelvic ultrasound to see if another possible cause we didn't actually mention in the first session, but is well, actually, we should mention this, is like thickening of the uterine lining. So what's called endometrial hyperplasia, and that can go along with polyps of the lining that can sometimes lead to bleeding between periods. So the doctor can see that on an ultrasound, and that ultimately, that kind of thickening of the endometrial lining, that is from the high estrogen, low progesterone hormonal picture that we talked about. And then on the ultrasound too, the doctor can see if there are any fibroids. If there sometimes on ultrasound you can see adenomyosis, which is a condition we talked about. It's not always visible on ultrasound. It's one of those conditions that can be a little bit hard to pick up sometimes. Yeah, so did I miss anything there? That's usually what would happen.
Yeah, the antibodies.
Yeah.
Reverse T3, would you ever test that, and urinary iodine?
I don't actually, in terms of thyroid assessment. We can talk about that a little bit more. I mean, I used to. Reverse T3 is just this thing where it's sort of this, it's your thyroid could be fine, but your body is trying to slow down metabolism for different reasons. That could play a role in, I mean, lots of things can play a role. Lots of metabolic issues.
Those tests too.
Yeah.
Covered under Medicare as well. And so if we jump into medical treatments, Lara, tranexamic acid. It's an oldie but a goldie. Tends to be underutilized. Even mainstream. I remember, I've worked for a long time with medical doctors doing combined consultations, and I'll have these patients that are bleeding. They're losing a lot of this beautiful life force. They're not feeling great. My herbal treatments are really slow to work. They don't work fast. Sometimes it can be a good inclusion, just as a fast acting on the days of the heavy bleeding. Is that your experience as well?
Agree. Yeah, basically, I'm at the point where I think it's can be quite useful, and my patients do take it. It's, as you say, you just take it during the flow, so not every day, and it can lighten the flow quite substantially. And it's just quite a simple solution. Through my lens, it's much better than being on the pill, for example, which would be something that you have to take daily, or
uterus.
Exactly, or hysterectomy. So because when I started practicing 25 years ago, it was not uncommon at all for women by their late 40s to have had a hysterectomy to address heavy bleeding. That's how it used to be addressed. And so the fact that
better tools now.
We do have better tools. We have the tranexamic acid. We have hormonal IUD, which we're going to talk about, and
Shall we go into that one?
Ablation, which we can touch on as well. So there's a
Yeah,
few other
a little more
options.
extreme, the ablation, but let's go
Yeah.
into intrauterine devices and their
Yeah.
heavy bleeding.
So obviously in this topic, we're only talking about the hormonal ones. So the copper IUD is effective for preventing pregnancy. I mean, it's a totally valid option for certain situations, but it will make periods heavier,
Heavier.
about 20 to 30% heavier than they already are. So probably not a good option for heavy flow. But the hormonal ones, just to say straight out, I just been very clear about this. There's no progesterone in the hormonal IUDs. They're called that. They're called progesterone IUDs, but it's actually a medication called levonorgestrel, which is a progestin, which is kind of similar. It acts quite similarly to progesterone in the uterus, which is great, which is where you want it. But it does have kind of an androgen or testosterone-like effect on other parts of the body, which is just to full disclosure. I mean, it's a lower dose than you would get in the pill, for example, but it is still a contraceptive drug that some women do notice side effects from. So just to acknowledge that, but at the same time, I think it can be a lifesaver for women who are in that situation, like we described in the first episode, of losing up to 500 milliliters of menstrual fluid a cycle. The hormonal IUD reduces flow by about 90%, 90. So it's
significant.
quite significant. And just to point out, you can 100% use the hormonal IUD and natural things. It doesn't have to be an either or. Like, you could have it inserted and see if it feels okay, suits you. And at the same time, do some of the nice, like, estrogen lowering treatments that we're going to talk about in the next session. And you can even use natural progesterone at the same time as a hormonal IUD. So it does, yeah, it's just to say again, it's not a either medical or natural treatment. Like, you can, especially for this symptom, you can definitely combine them.
Lovely. And ibuprofen.
Yeah, well, it reduces flow by about 50%, again, just during when you take it. Big picture, I guess I might circling back to the tranexamic acid that we talked about at the beginning, that might be preferable in some cases. But certainly I'm just thinking more ibuprofen might be for a young woman, like, so just to say again, like the 13-year-olds, 14-year-olds who are bleeding through their pad at night and, onto their sheets and like that kind of picture. For one thing, they're going to outgrow that. They should, if their cycle matures to start making progesterone and a more mature menstrual cycle. That's not going to go on forever.
Those
But
estrogen receptors start to get more
yes, it's the
sensitive
estrogen
to what's going
receptors,
on.
absolutely, all that. So during that time, and this gives a little teaser of what we're going to talk about in session 3, but like, you could do dairy free with them. You could give them zinc. And this is totally kind of stealing some of the stuff from next session. And plus, you could just come in with a bit of ibuprofen during the flow, which is going to help with cramps and lighten the flow enough that it's okay. And plus, give her some iron. I'm just kind of contextualizing where a bit of ibuprofen might be suitable. Whereas a woman at 45 who's looking at maybe 6 more years of really heavy periods, in that case, I don't know that, loading up on ibuprofen each and every cycle is probably the best solution. But it's a interim solution. It's just nice to know there's something that can help
instantly. Yes, that's right. And the oral contraceptive pill, as you mentioned in the first part of the series, it's sort of the most common go-to.
Yeah, the go-to.
Yeah. Can you talk a little bit about that to us, Lara?
Well, I mean, I guess just to say, as you know, on the combined estrogen pill, it switches off the menstrual cycle and replaces it with drug-induced bleeds. So those bleeds are often going to be lighter. This is not a real menstrual cycle. So I guess, from a symptom relief perspective, yes, it can relieve symptoms, but what I consider quite a heavy cost for most women, in that it's shut down women's own hormones, which, especially during their 40s, any age really, we need them. And so I feel it's a little bit, one of the analogies I used to give is like a little bit like killing a frog with a steamroller. Like, it's just overkill. It's like, it's just, there was a symptom that needed addressing. as we've discussed, there are some more precise methods of lightening flow. And I think I think we're going to outgrow collectively medicine is going to outgrow this habit of giving the combined pill for everything. I just think we're not going to keep doing that, but it's good to have it as an option.
And again, maybe just short term, like, look, let's just switch all of these hormones off for a minute. Let something else do the job while we work out what's going on in the background. But there's probably better ways to do that.
Yeah.
To switch everything off.
Yeah, for sure. Yeah. So another actually quirky medication that can actually help quite a lot. We already talked about ibuprofen, like just an over-the-counter medication that can lighten periods. Another one that lightens periods is antihistamines. So I just had a patient a few weeks ago. She was up in that territory of like probably 300 milliliters a cycle, like, and her doctors hadn't done much yet, unfortunately, but like, so she was really sort of struggling, trying to figure out, they'd offered the pill, and she's like, well, surely there must be other things. So, but she said, but coincidentally, she's like, actually, I'm in quite a good phase with it right now. It's spring here in New Zealand. And I was like, oh, you're in a good phase with it. And then she mentioned that she was on antihistamines for hay fever. I'm like, well, actually, so her flow is about half of what it had been. Wow. Just because she was on, I said, well, I think that's the antihistamine. She's like, yeah, I think you're right, because nothing else had changed. And actually, there's at least one scientific paper out there where it was more like a case study where they gave very intriguing antihistamine like vaginal pessaries, because there is, and we're going to talk about it in the natural treatment section, but the uterine lining is full of mast cells and immune cells. So, and they release, in addition to histamine, they release heparin, which is a blood thinner. So there is definitely this like immune aspect to heavy flow, and that's another way to target it. So I guess I'm just thinking, what made me think of it is when you were saying, oh, just to give women a break, like just to have a break for a couple of months while they kind of think about what they're going to do. Something like antihistamines could do that too. You wouldn't have to necessarily have to resort to the pill for that.
That's why, as integrative naturopaths, we love the options that are available to us from that mainstream medical model.
Yeah.
And they're fantastic. They can also be diagnostic. If the tranexamic acid works, we know that there's something around the coagulation that's going on, and we should look further in this direction. But antihistamines are such a lovely inclusion, and we'll talk at the nutrients in the next one.
Yeah, for sure. We'll talk about that. Yeah,
because I often have young women with quite serious period pain as well, which I know is a different talk. But the antihistamines will quite often work to help with period pain as well. So it's an interesting phenomenon for sure. Okay, Lara, thank you so much. I'll join you in the next session where we talk about natural treatments, which is our area of expertise. Thanks, Lara.